Good evening, and thank you for joining us for our first Facebook Live roundtable discussion on the impact of epilepsy on the Black community and the latest advancements in treatment. I am Ellis Dean, the Director of Digital Programming and Production here at BlackDoctor.org, and it is an honor to be hosting this, which is our inaugural discussion on epilepsy. Today, I am joined by Natalie Beavers, an advocate and someone with epilepsy who will share her experience about living with epilepsy, as well as Dr. Omatola Hope from Houston Methodist, Sugarland Neurology Associates, and Lucretia Long, a nurse practitioner from the Ohio State University, who are joining us to provide important information on epilepsy and highlight some of the latest advancements in treatment. Natalie, Dr. Hope, and Lucretia, it is great to have you.
It's great to be here.
Excellent, excellent. So, we're going to have you, because I just gave you all names and brief things. So I want y'all to introduce yourselves. Jay-Z would say, allow me to introduce yourself. So I allow you to introduce yourself today, starting with you, Natalie.
Hello, everyone, and thank you all so much for having me here today and to just share my story living with epilepsy. But I am Natalie Beavers. I'm a native of Atlanta, Georgia, born and raised. I am a mother of two amazing boys, Cameron and Carlton, and I've been living with epilepsy for 40 years. I'm also a founder of Angels of Epilepsy nonprofit charity and advocacy as well. And I'm an advocate, I'm a survivor, and each and every day, this is my work. I support, I advocate, and definitely try to make change for the epilepsy community, especially those in the minority community as well, battling with epilepsy and seizures.
Welcome. Dr. Hope.
Hi, I'm Omatola Hope. I'm really happy to be here. I'm excited that we're talking about epilepsy. So thank you. So I'm a neurologist. So neurologists are patients that treat people that have neurological diseases, including epilepsy. And I chose to further specialize to take care of persons with epilepsy and seizures. I've actually trained in the Northeast at the University of Pennsylvania and did my residency and fellowship at Yale New Haven Hospital in New Haven, Connecticut. But I've been in the Houston area now for more than 14 or so years and been taking care of really the sickest of the sickest epilepsy patients. So I'm excited to be here to talk to you guys today.
Hello, guys, and thank you so much for the opportunity and really the privilege to participate in tonight's discussion. As mentioned, I'm Lucretia Long. I am an epilepsy nurse practitioner and clinical associate professor of neurology at the Ohio State University. I'm also in the final stages of completing my doctorate of nursing practice at Duke University. Again, super excited to be here. So thank you so much for the opportunity.
No, thank you all for joining us. So you can see we have a robust panel here. I like the way both of y'all just kind of just skirted through like all your education. Like, okay, Dr. Hope, you was at Yale, you was at Penn, you're doing it. Okay, I'm just trying to get y'all to understand. And I want the audience to understand the amount of really expertise and people that care about this subject matter. So we're really happy, and I said it in my introduction, we're talking about this for the first time. We have not talked about epilepsy on Black Doctor, and I'm really happy that we're doing it, and we've got the great group to start us. So give yourself a shout out for that one. So let's get into it. For our listeners who may not be familiar with epilepsy, Dr. Hope, can you explain what this disease is?
Absolutely. Thank you again for having me here. So epilepsy is actually not one disease. I would say epilepsy is a bunch of diseases. However, what all of these diseases share, what is the one feature that they all share, is that the people have a susceptibility or vulnerability to having repeated seizures. So I want to be careful though, because I want us to differentiate between just having a seizure for, let's say, your blood sugar runs low. That is not epilepsy, right? So epilepsy is you have two or more unprovoked seizures. You know, they're not coming because you have a fixable problem like a blood sugar issue or a salt level in the bloodstream issue. And these two seizures are usually separated by at least 24 hours, right? So you've had a seizure one day, and then you have a second seizure 24 hours or more later. And that suggests that your brain is vulnerable to having seizures. And that's what epilepsy is. A diagnosis can be made at that point and treatment can be started. Now, there is another situation where you may have just had one unprovoked seizure, right? One seizure that came out of the blue. And based on the testing that your doctors did, you know, you had a electroencephalogram, also called an EEG, and you had an MRI of the brain. And based on the testing, they kind of know it's almost 70% chance that you're going to have a future seizure. So in that case, based on the testing, you're not going to wait for a second seizure. You're going to make a diagnosis, the person has epilepsy, and treatment can be begun. So that's basically what epilepsy is.
And Dr. Hope is exactly right. This debilitating disease affects about 3.4 million people in the US, and about 1 in 26 people will actually develop epilepsy or recurrent seizures at some point in their lifetime. And certainly, as many of you on the call know, uncontrolled epilepsy can limit and really negatively impact not only the patient's life, but also their caregivers. And it really can put a roadblock in place for people living with the disorder, ranging from the inability to drive as well as challenges at school and, of course, within the workplace.
Well, it sounds like epilepsy must leave quite a footprint around the world. But as you know, we're here on Black Doctor, so we want to ask who is most affected by epilepsy and what impact is it having on our community?
Yeah, so epilepsy affects somewhere between 50 and 70 million people across the world. Interestingly, about 80% of those active cases are actually in lower and middle income countries. Now, in the United States, according to the US Census Bureau and the CDC, 578,000 African Americans have epilepsy and seizures, and every year more than 25,000 are diagnosed with epilepsy or seizures. This is something that you will continue to see. Interestingly, more African Americans are likely to be diagnosed with epilepsy, or generally the risk of the probability of being diagnosed with epilepsy is higher in African Americans when you compare to white Americans. You can see that if you've gotten a diagnosis of epilepsy, right, you'll be concerned about getting the right treatment, right? So you want to get on the right medication. You want to find the best treatment with the least side effects for yourself. And we know that often epilepsy care can be complex, and there are specialized centers called comprehensive epilepsy programs across the country. These often require that you have insurance, and so we can see that there is limited access often for patients, especially African American patients, especially if they don't have the right coverage, the right kind of insurance. We also have evidence that even if you get access to a comprehensive epilepsy program, that sometimes some of the complex treatments like surgeries are underutilized. So it's definitely something that we worry about, getting people, Black people, getting underinsured people, getting people from other marginalized communities access, right? So getting them in to get the best treatment, but also when they're in, making sure that they're offered the best treatments for their particular type of epilepsy.
Absolutely, Dr. Hope. And not only is there evidence of underutilized surgical options for people of color, but recently there was a study that suggests that we as African Americans are less likely to receive quality care, including the reduced opportunity to be given novel or newer anti-seizure medicines when compared to our white counterparts. And not only, as Dr. Hope mentioned, are we more likely to be diagnosed with epilepsy, but we're also more likely to experience prolonged seizures or seizures that last longer than 5 minutes. And unfortunately, we are at a higher incidence in terms of risk for sudden unexpected death in patients with epilepsy.
So Natalie, I know you've been sitting there quietly and listening to all of this wonderful information and, about what's going on in epilepsy, but they're talking about it and you're living it. So can you tell us about your experience with epilepsy?
Yes, living with epilepsy for over 40 years. I was diagnosed at the age of 5. So being that young, I don't remember too much. It was in the early 1980s. But from what my parents, told me, I had a very high temperature that was, uncontrollable. And I started to seize, and they took me to the emergency room. And they did MRI scans. And as well as CT scans, and they diagnosed me with epilepsy and said, you need to take your daughter to see a neurologist in reference to this. And they also did testing, and they found a scar on my left temporal lobe the size of a dime. And they said, your daughter has epilepsy. Back then in the early 80s, they just hand you a brochure and say, take this medication.
Right.
It's not like it's not like it really is today, with so much other, suggestions and pamphlets and even medications. It wasn't like that in the early 1980s. So my father kind of took it in his own hands. He was a firefighter. And he kind of took it in his own hands and went to the library to say, hey, I need to find out about epilepsy so I can just go to the school, tell the school nurse that, hey, my daughter has epilepsy. Let me give you guys some information just in case you need to know. So, yeah, living with it for 40 years right now. So I'm thankful.
Well, you said something special right there. You said he went to the library. Do people use the library in 2020? It's like that. Back then, people were using the library, but no, seriously, like that is really exemplary of somebody that you had an advocate, and your advocate was your father, right? And
yes,
he was,
absolutely.
okay, I'm not just going to stand by and just take this brochure of medication. I'm going to learn about this. And how did that help you in terms of your experience with epilepsy, having an advocate there in your house?
It helped me quite a bit, because, not just my dad, my mother, my siblings. I had 2 sisters, and while I was at elementary school, they would literally, if I were to have a seizure in class, they would call my sister, because my sister would be there to actually kind of help more so having seizures, even just like on the school bus. Things like that. The good thing also, too, I appreciate the friends that I had at school and in the community, because they didn't look at me different. They say, hey, we want to help Natalie. If I were to have a seizure on the playground, on the school bus, they were there to assist me. Again, back in those days, it was somewhat different compared to today. Now people have telephones and things like that,
Right.
But definitely, just having a family to just learn about epilepsy, in those days, and how the seizure first aid, tips, the safety of it and all of that. So I greatly appreciate that.
Absolutely. So Dr. Hope and Lucretia, you're seeing, you're hearing her story firsthand. Could you do a deeper dive into how this disease impacts the African-American community?
Yes, absolutely. You've heard that many millions of people are affected by epilepsy. According to the CDC, males and non-Hispanic Blacks actually die at a higher rate from epilepsy and its complications than others. So that's no good. We've also haven't talked too much yet about stigma and fear, misperception about the disease and what it is, and of course, the discrimination that is caused by those fears and the stigma. So we are certainly more likely to experience those kinds of issues than others.
That's a really good point, Dr. Hope. And despite these statistics, there really remains a lack of knowledge and understanding in general about epilepsy. And this includes the lack of awareness within the African American community. And in terms of some of those misperceptions that Dr. Hope mentioned, there was a study that suggested that patients or African Americans actually believe that epilepsy is contagious or has a spiritual cause instead of a physical one. And certainly in at least one study, there was some evidence that a lack of knowledge and these misperceptions in our community really increases the stigma burden of African Americans diagnosed with this condition.
I mean, other issues have to do with just lack of social support, supporting family members with epilepsy, taking them to their appointments, things like that. Limited financial resources. And also, a big issue is poor patient and provider communication, right? So, if you can talk to your doctor, you can talk to your provider about what you're facing, I think that certainly affects patients and their ability to really live fully.
Absolutely. So this is fantastic information. So if you're just joining us, we're with Dr. Hope from Houston Methodist Sugar Land Neurology Associates, Lucretia Long from The Ohio State University, and Natalie Beavers, who is sharing her story of living with epilepsy. This is the first segment we've ever done on epilepsy, and so we're excited to have you watching with us this evening. Also, the following is an important safety information for patients about Xcopri. It's cenobamate tablets. Xcopri is a prescription medication used to treat partial onset seizures in adults. Do not take Xcopri if you're allergic to cenobamate or other ingredients in Xcopri or have familiar short QT syndrome. Xcopri can cause serious or life-threatening skin rashes or other serious allergic reactions, which may affect organs and other parts of your body, like blood cells. Xcopri may cause suicidal thoughts or actions. Xcopri may slow your thinking and motor skills and may affect your vision. Do not drive, operate machinery, and do other dangerous activities until you know how it may affect you. The most common side effects include dizziness, sleepiness, headache, double vision, and feeling tired. Discontinuation. Do not stop taking Xcopri without first talking to your healthcare provider. Stopping Xcopri suddenly can cause serious problems. Stopping seizure medication suddenly in a patient who has epilepsy can cause seizures that will not stop, or called status epilepticus. I think I said that right. So please see additional safety information and a link to full prescribing information, including medication guide, at the end of this presentation. So, Natalie, we've learned a lot about epilepsy already, but we want to hear more from you. Can you tell us more about your personal experience with epilepsy?
Yes, living with epilepsy for 40 years now, I've gone through so much, and again, being diagnosed at the age of 5. I was seizure free for a point in my life, going into middle school, and even, actually, the end of middle school and being seizure free going into high school. And at that particular time, my doctors thought that, hey, she's seizure free. She no longer has to take any medication. And we were like, wow, it's no more. But my freshman year in college, my seizures returned. My sons, as well as my family, they had to literally become my caregivers. And I really didn't want that to happen being young. But they had to become caregivers for me because having epilepsy, your brain controls everything in your body. And it was just a lot that I had to deal with, battling with my seizures. It was amazing to me how my sons had to learn seizure first aid at a very early age, but I also felt kind of, I guess, at fault because my children had a different life compared to other children being a caregiver at an early age. But they stated to me, Mom, it's no problem. So that's, that gave me confidence. But also too, later on, in 2006, I had a seizure while driving. I was 18 months seizure free. Never would have thought, that I could have a seizure going to work, taking my nanny and my son to her house so his father can pick him up after work. And my son and myself, we were singing in the car. And all of a sudden, I looked over at my nanny and I stated to her, I don't feel right and I need to pull over. And I started to seize, she stated, and she had to take the wheel of the car. And unfortunately, this became a tragic car accident. That changed my life. It changed my life. It changed my children's life. It changed my family lives. And as you already would just know, someone going through something like that, mental challenges, because of this, But I've dwelled and have come through, and continue to basically live my life and try my best to think positive. I know that many things in life happens for a reason, but I just wanted to continue to live life and also just continue to share my story so I can at least you know have someone else to hear my story and to just let them know. And it's not too late. Continue to give them motivation and to let them know that it's not too late, in spite of you having this severe brain condition, because many people don't know that epilepsy is severe. You can become seizure free, but it can return as well. So I definitely share my story, to just give hope to a lot of epilepsy survivors, especially to those in the minority community, because they're the ones who really, really need the confidence and the support living with this severe brain condition.
So how do you protect your mental health, knowing that is a possibility, knowing that you've had some mishaps, some accidents as a result, knowing that you have to have a village around you that they could happen? How do you protect your mental health during these situations?
Definitely, talking with my mom and dad, talking with my kids, but I also learned about meditation and yoga about 8 years ago. And I really got a hold of meditation. And once I learned how to really dwell it and enhance it into my life, it's amazing dealing with meditation. And that helps give me a good spirit in spite of me, thinking about things from the past, or wow, I can't drive, or I need to do this, or wow, I have so much going on, or I want to be at my son's game, but I can't.
Right.
Having meditation, it kind of helps you to just stay calm, turn the negative into positive. And my organization, we actually give free, sessions related to yoga and meditation that could help, dwell those in the epilepsy community. So it's great.
So tell us some more about your organization. What motivated you to start that organization?
I was in the hospital. I had 2 brain surgeries, craniotomies, in 2001, in 2007, and the other in 2008. And I spent a lot of time in the hospitals for pre-operation, the testing and all of that. And I met so many other epilepsy survivors while I was there at the hospital. And we were talking, and I'm like, wow, we have similar stories. My parents were talking to the other parents and caregivers who was there, and they were like, wow, we have similar stories. And it was, we were interacting with a lot of those in the minority communities. And I sat down and told my dad, I looked over at him and I said, I think I need to do something. And he said, do what? And I said, I believe I need to do something within the epilepsy community, like start a support group or a nonprofit organization or something. And I remember my dad said, don't be a sayer, be a doer. And that's what gave me the courage to say, I'm going to start a nonprofit. And right before my final brain surgery in November of 2008, that's when Angels of Epilepsy nonprofit organization was launched.
That is fantastic. So, as y'all heard, I was talking about exculpatory. So, are you taking it, and what have been those results for you?
Yes, I started taking exculpatory in March of last year, 2022, and I will be seizure free March 17th of this year. So I am so happy. If those out there who are living with epilepsy and you're walking in shoes and being seizure free, even if you're seizure free for a month, it's like, yay, like you're a cheerleader. So if you can imagine being seizure free for an entire year, it's like you just feel fabulous. So it has helped me so much. And I'm also just more involved into the organization. I'm also more involved into my advocacy, in the epilepsy community. So I absolutely feel great.
Well, I'm going to say something that's it sounds like your father was an amazing person. And I'm just going to speak up for him being an advocate for you from birth on, and then being your support when you thought about trying to become an advocate, being not just a patient, but an advocate. And him supporting you in that. So shout out to your father and what he's done and what he's doing in your life. So I'm just gonna throw that out there because he sounds like a very fantastic man.
Yes, absolutely.
So we need to kind of seem like we need to learn a little bit more. So can we tell us some more about Xcopri, Dr. Hope, for those who may not be familiar with that medication?
Sure. Natalie, your story is really inspiring. Thank you for sharing. I mean, just hearing it today, it's been wonderful. Thank you. Medications are important, right, to treat seizures. One of the important things is that we have some patients that are kind of more difficult to treat. They're difficult. And somewhere between 20 and 40% of people that have epilepsy will be difficult to treat, means that they're still having seizures, despite taking one or two medications, despite maybe having had a surgery and taking a medication. So it's always great when there is a new medication that's available to see if we can make a dent in that number, that 20 to 40% number. Cenobamate, the brand name is Xcopri, is a medication that was approved quite recently in the United States. This is approved for people, adults, with focal seizures. The old name is partial onset seizures, but it's the same idea that it's treating epilepsies or seizures that come from a specific part of the brain. So epilepsy, Xcopri, cenobamate, is a medication that has had, like every medication that's approved in the United States, at least 2 large clinical trials. Data from these clinical trials are compared, so patients are in a group that take Xcopri, and there's another group that's being compared with those patients who are taking a sugar pill or placebo. And so the data from at least from one of those clinical trials show that when you took Xcopri, there was a 55% reduction in your seizure frequency compared to 24% reduction in that placebo group. So really a significant difference between when you compare the placebo to Xcopri. Xcopri, we're happy that it's available and we can use it in patients like Natalie. It's just great.
Absolutely. And those are really, really important findings, Dr. Hope. In that same study, about 1 out of 5 people on cenobamate actually got to 0 seizures. And so that's really, really significant, particularly when you take into consideration the difficulty of seizures in the patients who participate in research or industry-initiated drug trials. So 1 out of every 5 people became seizure-free. I believe since its launch of cenobamate in May of 2020, it really continues, as Dr. Hope mentioned, to be an important option for people with partial onset seizures, which again are those seizures that start from one part of the brain. And I think there's been over 248,000 prescriptions written for Xcopri.
Well, it sounds like that's a dual kind of purpose, right? So we've got the actual lived experience with Natalie kind of talking about her experience with Xcopri, and then we've got the data behind it that's supporting that it seems to be working, particularly, and we love to see here on Black Doctor that we have an actual Black patient that's using it and talking about it. And so that is another kind of plus for Xcopri. Now, the final question I'd like to ask you all is, is there anything that patients should be asking their doctors, particularly, patients that are experiencing or that have been diagnosed with epilepsy? What should they be asking their doctors? Natalie, we'll start with you on that one, since you are a patient. What should they be asking their doctors?
I believe that, I consider my doctors as like friends. If you can talk to your friends about anything, you can talk to your doctors too. And every time I go to the doctor, they say, "Oh, what does she has for us today?" Because I have a notepad of questions, that I have from my doctor. So I just think it's very, very important for, patients to not be a little ashamed or afraid to, question anything that they feel that could help them, dealing with their seizure activity or medications or anything like that. I also advise epilepsy survivors as well as parents to kind of do your own research as well in reference to this brain condition. Know that there are different types of seizure medications out there, and don't be afraid to just ask questions. Because again, there's a doctor and there is a patient, and you have to have that connection. And I'm very, very thankful to have a connection with, my doctor here in Atlanta, where we actually literally talk in reference to, my condition or any concerns that I, possibly have, definitely.
I love that, Natalie. I love that approach. I always tell my patients it's not a dictatorship, right? It's a collaboration. And so, as Natalie mentioned, it's really, really important to work with your care team to determine which treatment is best for you. There are multiple medications, as mentioned, surgery options. So we really want to make sure that we customize and really optimize care for you to make sure that you're finding the right treatment solution. And again, it takes a village. So I do appreciate, Natalie, I love your story. I love the idea that you feel comfortable communicating with your provider. I always tell people, if you're asking questions with the provider and they are offended, you need to run really far, because you should be able to communicate with that provider. I encourage my patients to ask questions. We want to make sure we give you the information that you need so that you can live with this condition. And so again, I applaud your efforts, Natalie, with everything you're doing. For those of you on the call who are having symptoms, make sure you speak with your healthcare provider. And certainly for those of you interested in learning more about XCOPRI as a treatment option for seizures, please visit xcopri.com for up-to-date information.
Absolutely. And that site is scrolling across the bottom of the screen as well. So you can visit xcopri.com to learn more about this medication. So it's just been a joy to talk to you all. It's just been, I love the energy. Natalie, I could talk to you all night long. You have such a warm and wonderful spirit. And we just really feel encouraged about, and I'm hoping the people that are watching are feeling encouraged. If they know somebody that has epilepsy, or if they've been diagnosed themselves, I hope they feel encouraged by just hearing your story and knowing that you're out there advocating not only for yourself, but for other people that are experiencing epilepsy. So I want to thank you, Natalie, of course, Dr. Hope and Lucretia, for joining us today. This is a fantastic conversation. And thank you to all of the viewers who joined us as well. This discussion will be available on our Facebook page as well as our YouTube channel for future viewing. We want to take care, everyone, and have a wonderful evening. I'm going to show, so stick around. There is some important information about XCOPRI. So if you're interested in learning more about XCOPRI, stick around. Thank you all for joining us, and we look forward to speaking to you too again when we do our second show on epilepsy. We're not one and done. We're going to do one, and we're going to continue to do this because it is really, really some great information that we need to share with our audience. So thank you all for being here and sharing with us this evening.
Thank you. It's an honor being here.
Absolutely. Thank you for the opportunity.
Thank you so much.
Important safety information and indication for XCOPRI, cenobamate tablets CV. Do not take XCOPRI if you are allergic to cenobamate or any of the other ingredients in XCOPRI. Have a genetic problem called familial short QT syndrome that affects the electrical system of the heart. XCOPRI can cause serious side effects, including allergic reactions. XCOPRI can cause serious skin rash or other serious allergic reactions, which may affect organs and other parts of your body, like the liver or blood cells. You may or may not have a rash with these types of reactions. Call your healthcare provider right away and go to the nearest emergency room if you have any of the following: swelling of your face, eyes, lips, or tongue, trouble swallowing or breathing, a skin rash, hives, fever, swollen glands, or sore throat that does not go away or comes and goes, painful sores in the mouth or around your eyes, yellowing of your skin or eyes, unusual bruising or bleeding, severe fatigue or weakness, severe muscle pain, frequent infections, or infections that do not go away. Take XCOPRI exactly as your healthcare provider tells you to take it. It is very important to increase your dose of XCOPRI slowly, as instructed by your healthcare provider. QT shortening. Xcopri may cause problems with the electrical system of the heart, QT shortening. Call your healthcare provider if you have symptoms of QT shortening, including fast heartbeat, heart palpitations that last a long time, or fainting. Suicidal behavior and ideation. Anti-epileptic drugs, including Xcopri, may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your healthcare provider right away if you have any of the following symptoms, especially if they are new, worse, or worry you. Thoughts about suicide or dying, attempting to commit suicide, new or worse depression, anxiety, or irritability, feeling agitated or restless, panic attacks, trouble sleeping, insomnia, acting aggressive, being angry or violent, acting on dangerous impulses, an extreme increase in activity and talking, mania, or other unusual changes in behavior or mood. Nervous system problems. Xcopri may cause problems that affect your nervous system. Symptoms of nervous system problems include dizziness, trouble walking or with coordination, feeling sleepy and tired, trouble concentrating, remembering, and thinking clearly, and vision problems. Do not drive, operate heavy machinery, or do other dangerous activities until you know how Xcopri affects you. Do not drink alcohol or take other medicines that can make you sleepy or dizzy while taking Xcopri without first talking to your healthcare provider. Discontinuation. Do not stop taking Xcopri without first talking to your healthcare provider. Stopping Xcopri suddenly can cause serious problems. Stopping seizure medicine suddenly in a patient who has epilepsy can cause seizures that will not stop. Status epilepticus. Drug interactions. Xcopri may affect the way other medicines work, and other medicines may affect how Xcopri works. Do not start or stop other medicines without talking to your healthcare provider. Tell healthcare providers about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Pregnancy and lactation. Xcopri may cause your birth control medicine to be less effective. Talk to your healthcare provider about the best birth control method to use. Talk to your healthcare provider if you are pregnant or plan to become pregnant. It is not known if Xcopri will harm your unborn baby. Tell your healthcare provider right away if you become pregnant while taking Xcopri. You and your healthcare provider will decide if you should take Xcopri while you are pregnant. If you become pregnant while taking Xcopri, talk to your healthcare provider about registering with the North American Anti-Epileptic Drug, NAAED, Pregnancy Registry. The purpose of this registry is to collect information about the safety of anti-epileptic medicine during pregnancy. You can enroll in this registry by calling 1-888-233-2334 or go to www.aedpregnancyregistry.org. Talk to your healthcare provider if you are breastfeeding or plan to breastfeed. It is not known if Xcopri passes into breast milk. Talk to your healthcare provider about the best way to feed your baby while taking Xcopri. Common side effects. The most common side effects in patients taking Xcopri include dizziness, sleepiness, headache, double vision, and feeling tired. These are not all the possible side effects of Xcopri. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. Drug abuse. Xcopri is a federally controlled substance, CV, because it can be abused or lead to dependence. Keep Xcopri in a safe place to prevent misuse and abuse. Selling or giving away Xcopri may harm others and is against the law. Indication. Xcopri is a prescription medicine used to treat partial onset seizures in adults 18 years of age and older. It is not known if Xcopri is safe and effective in children under 18 years of age. Please see additional patient information in the medication guide. This information does not take the place of talking with your healthcare provider about your condition or your treatment. Please see medication guide and full prescribing information.